Hello, my name is Julie Emerson. This presentation is called Clinical Decision Support for Heart Failure, a proposal for the hospital setting. This presentation will cover heart failure in the hospital setting, identification and treatment using CDSS, CDSS and advanced nursing practice, CDSS in the hospital setting, and technical implications of CDSS. Heart failure has been a persistent challenge for hospitals to address. While hospitals have been focusing on efforts to manage heart failure better and reduce readmissions for more than 3 decades, according to a study by Kosiol et al. In 2012, heart failure patients consistently have had the highest hospital readmission rates among those with chronic illness. Heart failure patients have some of the highest readmission rates within 30 days, potentially reaching as high as 25%. The national average for all-cause hospital readmissions is approximately 19.9% for patients with heart failure. Furthermore, many heart failure patients and family members have difficulty managing their symptoms at home. The American Heart Association has identified several evidence-based strategies to improve the management of heart failure during hospitalization, according to a study by Heidenreich et al. In 2022. Additionally, there are evidence-based interventions to prevent readmission after discharge, according to a study by McCants et al. In 2019. However, for some reason, these interventions are not consistently taking place. These missed opportunities to optimize patients, educate them, and provide community resources to help them self-manage care at home result in a cycle of repeat hospital readmissions. Clinical decision support systems can assist hospital providers in identifying, managing, and planning for the discharge of patients with early heart failure, thereby preventing future hospital readmissions. So, why do heart failure readmissions matter? Simply put, readmissions are an indicator of the quality of care. Readmissions are costly. Hospital readmissions due to heart failure alone cost more than $50 billion per year, and they are projected to reach about $70 billion per year in the next 5 years. While hospital readmissions are expected when patients are at end of life, for most patients with chronic disease, readmissions are preventable. Incorporating a CDSS to address early heart failure identification, evidence-based therapies, education, nutrition, and discharge planning interventions is a comprehensive approach to improving patient outcomes and reducing heart failure readmissions. The next slides will review the functional components and structures of CDSS. For this project, the CDSS system being proposed is EPIC. Information about EPIC software can be found on the internet at the EPIC website listed at the bottom of the screen. EPIC is the product of choice because the hospital is already using it, so the costs would be minimal. A heart failure CDSS platform integrated within the EPIC EMR already has been trialed successfully in the San Francisco market for a similar function. This solution combines a heart failure predictive model with associated inpatient interventions and transition interventions to prevent hospital readmissions, according to a study by RATS in 2025. Starting with an interface that has already proven to be successful, the plan would then be to incorporate a CDSS feature that will facilitate early identification and monitoring of heart failure patients. This process would begin at triage in the ED on a separate dashboard with passive alerts visible on the toolbar to reduce alarm fatigue. Advanced practice nurses could benefit from clinical decision support in the following ways. CDSS helps nurses correctly identify what is wrong with a patient. CDSS provides nurses with opportunities for professional growth and competency by providing suggestions and prompts that might be otherwise overlooked. CDSS model development has the potential to standardize nursing protocols using evidence-based practice. The benefits of CDSS for advanced practice nurses are as follows. The heart failure CDSS predictive model will help advanced practice nurses identify heart failure in the early stages of disease. Real-time evidence-based intervention prompts would offer solutions that might have otherwise been overlooked. Transition intervention recommendations would provide support options for the community setting. The next slides will review the organization utilization of CDSS. The healthcare setting chosen for this project is a 385-bed Level 2 acute care hospital in Ocala, Florida, located in Marion County. The hospital employs more than 2,030 staff members. More than 780 staff members are nurses. The hospital has 3 emergency departments, an on-site emergency department, and 2 additional emergency departments in the community. The hospital serves an expanding population. More than 11% of Marion County residents moved into the area within the last year, according to the Florida Legislature Office of Economic and Demographic Research, 2025. Approximately 29.3% of Marion County residents reside in rural areas, according to the University of Wisconsin Population Health Institute, 2025. The parent healthcare organization of the hospital has a total staff of over 100,000 employees in 9 states across the U.S. In the Ocala area, the organization has expanded its availability of primary care and specialists, recently adding a 60,000 square foot medical office building next to the hospital. The organization also owns a durable medical equipment company, a home infusion company, and has significant ownership in a home health agency that serves the area. The company also has expanded into medical transportation, currently offering limited services in the Ocala area for hospital-to-hospital transfers only. The most important stakeholders for this project are the patients and family caregivers. Patients and family members will be the parties receiving services and are the most affected by any changes made to their care. Patients and family members can voice how well the hospital treatment team addressed their needs through surveys conducted after care. The clinicians and providers treating the patients are key to the project. They will be the staff that use the CDSS the most and should have a voice in how the CDSS is developed and implemented to be the most useful for their day-to-day needs working with patients. If the clinicians and providers have a say and a buy-in into the heart failure CDSS project, They will be much more likely to use the platform and to encourage other clinicians to use the platform as well. Clinician inclusion in the platform development could also help mitigate design flaws and ensure that the software is useful and addresses the team's needs. The hospital administrators have a vested interest in this project. The Chief Executive Officer and Chief Operations Officer make decisions about whether the project will accomplish the goals set for the organization. The Chief Financial Officer is responsible for the budget and provides the ultimate financial approval for whether this project goes forward. The administration team meets with local community leaders to address how the organization can meet pressing community concerns. The Quality and Risk Management team oversees all risk-related issues concerning staff and patients. In this case, the Quality and Risk Director, a registered nurse, oversees all items related to heart failure readmissions. She reports to the hospital administrators regarding the hospital's management of relevant risk issues. Chronic health care readmissions that Medicare has identified, such as heart failure, are part of her purview. The Quality and Risk Management Director holds biweekly readmissions meetings, has hired an advanced nurse practitioner to address readmissions at the emergency department level, oversees the heart failure coordinators, and also oversees the nurse navigators who follow select patients after discharge. The clinical informatics team, in conjunction with the information technology team, will work together to design and roll out the new heart failure management platform for Epic. The clinical informatics team, comprising of registered nurses, provides evidence-based, research-supported recommendations regarding technological solutions to address workflow or patient care needs. The IT department will create the platform and write the algorithm for the software. The IT team is also responsible for updating and correcting the software. The clinical informatics department will roll out the education to the ordering providers, specialists, and clinicians who will be using the heart failure platform. The informatics team will also troubleshoot any implementation snags and act as a liaison between the clinical staff and the IT department. The next few slides will go over technical implications of CDSS. The plan for this project, the Heart Failure CDSS project, is to integrate a proven predictive model platform which has been successfully applied in another Epic market to address heart failure readmissions. This proposal involves building upon an existing CDSS model and then adding additional CDS support through previous identification of heart failure from existing medical records, big data mining, and monitoring and identifying new onset heart failure patients during hospitalization. This type of heart failure diagnostic CDSS tool combines knowledge-based workflow, rule-based reasoning, and statistical analysis with non-knowledge-based artificial neural networks that learn from big data. The heart failure CDSS will be made up of both an inpatient treatment checklist and a discharge planning checklist. These evidence-based interventions outline the parameters that the knowledge-based reasoning is built upon. The result will provide providers with an up-to-the-minute bedside tool to help clinicians follow evidence-based treatment guidelines for heart failure patients during their inpatient stay and recommend evidence-based discharge planning supports to prevent readmission. There are risks and benefits. Some of the CDSS project's potential risks include poor algorithm construction, incomplete data, and unintended bias programmed into the system, all of which could potentially lead to CDSS errors resulting in missed or erroneous diagnoses and treatment plans. Other potential risks include poor platform design, incompatibility with workflow, or too many pop-ups causing alert fatigue and leading to application abandonment. Because CDSS and machine learning are not infallible, the clinician is ultimately responsible for the diagnosis and treatment plan prescribed for the patient. The potential benefits of the heart failure CDSS platform project are improved patient outcomes, fewer heart failure readmissions, and lower healthcare costs. Other possible benefits include improved resource allocation and enhanced workflow. Time spent in meetings trying to figure out what to do with the heart failure patients could potentially be spent solving other pressing concerns. The CDSS heart failure identification, inpatient and outpatient treatment platform has the potential to impact several departments within the hospital, with the potential to expand to hospital-affiliated primary care offices, cardiology offices, and home health services agencies. If successful, the CDSS platform could be applied to other chronic conditions like diabetes mellitus, chronic obstructive pulmonary disease, or even psychiatric disorders. Some final thoughts. For several decades, healthcare organizations have been seeking solutions to address the needs of heart failure patients and their caregivers. CDSS provides a cost-effective opportunity to enhance quality care and improve patient outcomes. CDSS has the potential to revolutionize the way that heart failure patients are identified and treated both in and out of the hospital. CDSS solutions for heart failure are projected to impact multiple areas of healthcare, both in the hospital and in the community. If successful in reducing heart failure readmissions, CDSS solutions will have widespread applications to other chronic illnesses such as diabetes and chronic obstructive pulmonary disease. Thank you so much for taking the time to watch my presentation. References are following.